Hello everyone, welcome back to our study of mind rubrics. And the rubric that we are going to study today is clairvoyance. So, what does clairvoyance mean? Clairvoyance means, like you see in this picture, that this person is able to see something in front of his eyes, but actually, that something is not happening. So he is seeing something that could happen in the future or that has happened in the past, but it is not happening in the present. So clairvoyant people seem to have this ability to see the future or the past. Hmm? So the definition of clairvoyance is supposed faculty of perceiving things or events in the future or beyond normal sensory contact. So there is no evidence, there is no sensory impression. I cannot see the bomb going off, but someone can. And this is an extrasensory perception out, not happening in, not I'm not able to see or perceive it with my present senses, that is my eyes or my smell or touch. I cannot see that something like this is happening or going to happen or has happened means you will see, some people will say, the energy of this place is very good, yeah, it's very nice. Here you should do it. Oh, this is a very bad place. There's something bad has happened here. Some kind of murder has taken place over here. Some kind of bad activity has taken place here. The energy is not good. This is what is clairvoyance. Someone is perceiving that this energy is not good over here, or this place is good or bad, or this is going to happen over here. This is the possibility, like like gurus, they tell, no, like you go to a guru and then he says, yes, I can see your future. I can tell you that in some years you this will happen, or in your life this is what it is like. Your wife is like this, your husband is like that, your family situation is this, your problem in life is this. Oh, Guruji, how did you know all this? So they say, just by seeing, just by observing. What did you observe? Hmm? That is clairvoyance. When someone can tell you your future or past without any evidence that can be perceived by the senses. So, like for example, we may see some people say, I can talk with the spirits, I can talk with dead people. They are telling that this person murdered me, this is how I was killed, this is what happened. So they can tell you where the murder took place, where is the body, who is the murderer, or what kind of wrong things happened to this person before his death. All this they can perceive and they can say. That kind of talk is what is clairvoyance. The energy of this place, that I already gave an example. And generally they will say, how do you perceive this? Because I'm very alert. They tell you that I am very alert, I am very vigilant. Slightest change here and there I can immediately sense. I can sense how this person is thinking, what he's going to do, what his intentions are, what his motive is, without he telling me, because I'm very alert, very, very vigilant, very attentive, very focused, full attention. So their senses also are very alert and active. I can smell the slightest thing, I can hear the slightest thing, I can taste the slightest change in food. Hmm? Immediately they can sense it. So they are prophesizing, no, this is going to happen in future. Remember, I told you that this is what is the future, this is what is going to happen on this date, on this time, this is going to happen. That is prophesizing. Prophesizing, predicting the future, fortune tellers, gurus, who communicate with dead people or even your ancestors. This kind of talk is the clairvoyant person's talk. Okay, but however, when I studied the main four remedies from this rubric, four remedies there are in high grade mark, so in Kent's repertory. When I studied, it's it's important that the all these remedies seem to have very acute or alert senses. They have very alert and acute senses. Hmm? This is important. Like Crotalus cascavella. I remember one patient I saw. He said that, doctor, I have lot of fear. I said, what is the fear? He says, when I have to go to my workplace, no, every day I have to walk through a area, and I have to walk through a farm, and it's a big farm. And in that farm, no, especially at the time I am walking through that farm, there is nobody in that farm area. It's like I am alone. So when I'm walking, no, I feel, something is going to come. Something is going to come and something is going to attack me. Hmm? So, when I walk and then slight noise comes, suppose I'm walking and a stone falls into the water in the field and then it makes a sound. Immediately I get alert. What happened? Who's coming? What happened? Any animal? I just check. Every time, the whole time I'm walking through that farm, I'm extra vigilant, like sharp, sharp. What is happening? Slightest change here and there, immediately I will like become extra alert. Somebody is coming. Somebody is going to kill me. Somebody is going to kill me. Somebody is attacking me. Somebody is attacking me. I'm getting scared that it's coming. Somebody is going to attack me. This is the main feeling of Crotalus cascavella. They have this strong sense that something bad is going to happen, and that bad is that someone is going to kill them. Someone is going to attack them. And because they are going to be attacked, they are hyper vigilant, alert. Hmm? Every time perceiving who is coming, who. And Crotalus cascavella especially develops this kind of feeling when they are alone. I'm walking in the farm and I am alone, nobody is there. When they are in the with people, no, they don't get this feeling. But if I am alone at home, then I become very alert. Oh, is the robber coming? Oh, is someone coming? Is somebody attacking? Oh, I took revenge like that. I hit that person. That person may come now. He might be planning something. What is this change? Is somebody planning anything? So Crotalus cascavera always feel like they are going to be attacked, huh? by their enemies, by their by the people who they have sort of taken revenge or hit or abused or something like that. Because in my anger I am very abusive, I can hit, so people will also get back to me. So they are very alert. People are going to get back to me. I have to be alert, vigilant. Hmm? So this snake theme of revenge, jealousy, competition, hmm, and most important thing is fear of being alone. And when they are alone, they feel they are going to be attacked, and that time they have very acute or alert senses. That is Crotalus cascavella. So they are always, their clairvoyance is they are always anticipating that something bad is going to be happening, and I am going to be killed. I'm going to be killed. That is their main clairvoyance. That somebody is going to kill me. Somebody is going to kill me. They have clairvoyance about their death. Next is Lysinum. Lysinum also, has this um, mm, clairvoyance that they are going to die. That somebody, they have fear of impending death. you know, somebody is going to come and get me and going to kill me. They are going to come and kill me. Oh, how do I get over this feeling, huh? And because of this fear that somebody is going to come and kill me, they start behaving mad. Lysinum is what? A rabid dog. Rabid, no, it's gone mad. So they will shout, they will yell, they will have lot of um, mm, anger issues. Okay, that they will say that, you know, I am feeling that somebody is going to come and kill me, somebody is going to murder me. So just sorry. In Lysinum, there is not somebody is going to come and kill me. It is in Crotalus cascavella. Lysinum, it is impending death, that I am going to die. I'm going to die. Lysin, it is very similar to uh, the rabies condition. So they feel they have such kind of incurable disease and nothing can happen, nothing can save them, and their death is imminent, it is sure. So what they do when they feel that they are going to die, they will feel that I want some kind of support, you know. You stay with me, they will beg and plead, please stay with me, please stay with me, please save me, please save me, please save me, god, 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 please save me out of this, please save me. They will beg and plead, and you will say, Are, what is, you're gone mad, what are you doing? Why are you pleading so much? No, no, you be with me. But then, people, they leave me. Then I get very angry, and then I become very abusive, and they will really abuse the opposite person. They will give them bad words, they will give them um, they will use very below the belt swear words, and they will abuse and insult that person. How stupid idiot are you, how could you do this? And they will do it to anybody, and even the elders in the house, even to their parents, even to their bosses in their offices. They will not care who they are talking to, what they are talking to, how they are talking. How can they talk such indecent, vulgar language? You'll feel, oh, this person is so vulgar, cheap, very cheap, vulgar language, dirty, hmm? Cheap आदमी है, very cheap kind of behavior. You'll feel like don't not even talk with them, very cheap. And if you ask this patient, why are you talking like this, they'll say, I have lot of anger and rage in me, so much anger and rage in me that I can't control myself. In that anger, you're not understanding, doctor, how much itching I am having, so much itching, so much. And you tell me, you wait, I can't wait, you give me something, you stupid idiot, give me something, I have to feel better now. What is happening to me? What is this? And then she will abuse. I actually had a patient like this. She used to abuse me, she used to call me, she used to say, I am itching now, immediately, now give me something now, immediately, otherwise I can't tolerate, do something now. So lysine is very impatient, that I want relief immediately, I want it now. They will be very cheap, they will be vulgar, they will not care that you are not picking up the phone. They will keep calling you, keep calling you. You have to pick up my phone, and then they will say that I am, this is their begging or pleading. I am begging this doctor so much, I am pleading that please help me, please help me, please help me. But he is not responding to my calls, he is not answering my questions. What can I do? I become so angry, then I send all kind of abusive messages to this doctor, and I abuse him, and I swear words. This is what lysine is like. If you don't help me now, what will happen to me? Oh, I will die with this, I will die with this itching. This itching is so much, it's very bad. I think it's some big disease. So you will feel like, they have this anxiety of disease, anxiety of impending illness, incurable illness. Is this some big disease? Oh, doctor, what can I do? Please help me, please help me, please help me. Arey, wait, I have just given you a remedy. It will take some time. No, 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 no. Blast. And they will abuse. They will keep calling you, keep calling you, keep calling you. How can you not pick up? How can you not pick up? 10 calls, 15 calls, they'll not stop. And then when you tell, no, I don't want to treat you, go, then they will become like, no, doctor, please, 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 no, 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 don't leave me. I was so faithful to you. I will pay whatever fees you want. I am very faithful. I am very committed to your treatment. Please, 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 please don't leave me. Please don't leave me. So they are dogs, no? So there is a element of faith and commitment and things like that. So that is how Lysinum is. Okay. Next is Nux mosqueta. Nux mosqueta. Nux mosqueta is especially developing clairvoyance. This is Nux vomica is actually very Nux mosqueta is actually very close to the meaning that we learned. That Nux mosqueta actually predicts the future of someone or tells you something that they may not know. Matlab, someone comes in front and I tell them their history, geography, everything. Person who I've never met, never seen, such kind of people I'm telling their future. Like this is what Nux mosqueta woman is. So it is especially indicated in women and especially during menstruation. If you see a woman who says my menses are very painful and very profuse, and during that menstruation, no, I have either headache or I have pain in stomach. Along with that, there is lot of drowsiness that I develop, lot of sleepiness, drowsiness. I feel like my consciousness is reducing. I'm going very drowsy. Sometimes I will faint with the pain. The dysmenorrhea pain that they have, they may faint with that pain because their senses are getting dulled. Okay, and when they have got into this dull state, no, when they are not conscious about the surrounding, when they are not aware of the surrounding, then if you wake them up and if you ask what is this, what is, suddenly they will start talking about, I know you, you are like this, huh, you, this is what will happen to you. Hurry, how could she talk something like that? In India, in villages, they will say that, mm, इस औरत में देवी आ गई है ना, like the god has come into this woman, and this woman is able to talk and able to say something that we don't expect her to say, or we don't expect her to know. How is she talking this, how is she telling this? She has never been like that, and she talks all of this in that unconscious state. She is not conscious, she herself does not know that she is being clairvoyant, that she is talking such things. But after this phase is over, when she wakes up, when she becomes conscious again, she will not even know what she talked. They are completely like, no, I don't know what happened over here. So Nux mosqueta, remember, it is for women, and it is especially for women during menstruation if they develop drowsiness, unconsciousness, and fainting. You'll see fainting very commonly. With the pain, I will faint, and then I am, or they are into this semi-conscious state in delirium where they will just talk and talk with clairvoyance. Nux mosqueta. Okay. Next remedy is phosphorus. Hmm? Phosphorus, phosphorus. Uh, I tried finding uh, the the reference for phosphorus, but somehow I did not get very clear reference. The closest that um, closest that can explain the phosphorus state is the um, in the proving it is written zoo magnetic, huh? So zoo magnetic clairvoyance, so which basically means that the person is very um, attracted. Magnetized means you get attracted to a person, to you get attracted to a animal or some object. Magnetized means to get attracted. I'm So the phosphorus patient's most common expression is, "Hmm, that doctor, I was so blessed that I could see this animal seal in front of me. Oh, it's very rare to see. Oh, I can see it so near. I'm so in awe of it. How beautiful it is. I just want to keep looking at it, keep seeing it, keep getting engrossed in it, and just this I enjoy. I just observing and getting absorbed into that animal. Hmm? And I have this sense, that this animal is going to come. When I am at the beach, when I am sitting, huh? Nobody is there. Everybody says, "Let's go." I say, "No, today, no. Shark is going to come. We will see a shark. It will come very near to the beach." No, no. And then it comes, and then we see. And then I'm in so much of awe. I saw the shark, such huge, so nice. It was such a great experience. That is what phosphorus is like. They are zoomagnetic. They one is this awe and getting absorbed and attracted to that object, and being in awe. Awe is very important expression of phosphorus. That awe means magnetized. I'm completely in awe of that person. When that superstar walks into the room, oh, I saw Shah Rukh Khan inside the room. Oh, so near. Oh, I was in complete awe of it. This completely magnetized. That is what is phosphorus. Hmm? So that is what they are clairvoyant about animals, about zoo kind of creatures. Hmm? But the hmm, main thing is uh, magnetized. I'm so attracted to that thing, no, that I sense that it's going to come. I sense it's going to come. I'm very attracted to it. I always wanted it, and this day I knew. Now today it will come. It will come, or he will come, or she will come, or this will happen. Out of that attraction, they sort of have this clairvoyance that this is going to happen out of their attraction to that thing. Okay, so there are no sub rubrics given by Kent in this rubric, and not much of cross references. So that's it, friends, about clairvoyance. This is what I understood from my cases, from my study of provings, etc. I hope this video is liked by all of you. I look forward to all your suggestions and feedbacks from this rubric. See you all soon. Till then, bye bye.